This is Chapter 1, Anatomy and Physiology. Chapter 1, Anatomy and Physiology. So let's talk about anatomy. So anatomy, when we think about it, we're thinking about the structures. So in this chapter, the learning outcomes are going to be to define anatomy, define physiology. We'll also look at some of the subfields of human anatomy. We'll also talk about the importance of dissection. We will describe some methods of examining a living patient, so that patient will be alive, and we will perform an assessment. And we'll also talk about some of the principles and applications of medical imaging methods. And medical imaging is important because that gives us an opportunity to look inside of the patient in a least invasive, a minimally invasive kind of way. So when we think about anatomy and physiology, they usually go together. Anatomy is the study of the structures that help our body to function. So we're looking at the organ systems. Physiology is the function or the job those organs and organ systems perform. And there's a phrase that we use when studying anatomy and physiology is that form follows function. So that means that the structure of the organ or organ system really helps it to perform the job that it's assigned to do. So form follows function. So let's talk about gross anatomy. So gross anatomy is not something that's icky. It means that what we can see with the naked eye. So we use our eyes to observe. And so this is just observation or maybe even a dissection, but we don't necessarily use a microscope. If we're studying histology, and we will do that in this course, we will look at tissue specimens that are thinly sliced and stained, and they will be observed under the light microscope. When we think about histopathology, we're looking at the microscopic examination of tissues for disease. And something that's important as you go on to your career studying anatomy and physiology and eventually nursing or medical school, whatever you are designed to pursue, try to break down the words into their different parts because that will help you understand what it stands for. So whenever we think about pathology, we're thinking about disease and something maybe causing a disease. So let's talk about surface anatomy. So surface anatomy is just looking at the surface. We're looking at the external structure of the body or the body part. And this is important for you to sharpen those skills, especially as you get deeper into your studies and you start conducting physical examinations. And when we do look at anatomy and physiology, we always want to do it in a systematic way. So a lot of times nurses will do a head to toe inspection or assessment of their patient. In anatomy and physiology, we're going to take one organ system at a time, and we're going to closely examine a body system, and we're going to look at the organs and the jobs that they perform. Now, regional anatomy is a study of multiple organ systems at the same time in a specific region of the body. An example of that would be looking at the gastrointestinal system, and we'll look specifically at the abdomen. Okay, so that's your regional anatomy. So functional morphology. So there's reasons behind the organ structure, and that is, okay, why is this organ shaped this way? We'll take the kidney, for example. If you were to perform a dissection of the kidney, you will see that there's a lot of curves inside. There's some structures inside, and those structures are important because they help with the absorption, the filtration, and making of urine. So there's reason why the kidneys are shaped in that way, and when we cut it open, we see all of the different curves and crevices inside of the kidney. So we think about comparative anatomy. That's always fun. We are comparing the anatomy of one or two or more species. And so this is helpful when we think about evolution. And an example of this given on the slide is that the human pelvis is best understood by comparison to a chimpanzee's pelvis. Other things that you may see in comparative anatomy is could be a human arm versus a bird's wing, and we look at the skeletal structure, the muscular structure of that, and so that is what we would look at for comparative anatomy. So when we think about examining the body, the simplest method, the least invasive method is inspection. We are just using our eyes to look, taking a critical look at this structure, looking at our patient. When we think about dissection, we are actually cutting and separating tissues to reveal the relationships. When we're dissecting, we're looking for muscles, we're looking for blood vessels, we're looking for ligaments and tendons. So that's what we're looking for when we do a dissection. And dissection is really important for accurately mapping the human body. In medieval times, they did not have all the knowledge that we have now. And so it's really important that we respect the cadavers, the humans that have donated their bodies to be examined. So, and even the animals that we use, we should be respectful. And sometimes if we're working, especially with human cadavers, take a moment to express gratitude for this life that was lost, that is now being used to help to advance science and our understanding of the human body, because that's really important and it's a great sacrifice. Okay, so how else can we examine the body? Well, besides inspection, physically looking at it, we also, as nurses, perform palpation. So we're feeling with our fingertips. Just a note of caution, if you think that you are going to come in contact with a patient's bodily fluids, always make sure you're palpating with gloved hands. Okay, that's going to be important. When we palpate, we're looking for things like swelling, swollen lymph nodes. We also could be taking a pulse of a patient. So palpation, we're using our fingertips. And note that your fingertips are very sensitive. Okay. Auscultation is listening. So listening to sounds that's made by the body. We usually use what's called a stethoscope, and we will auscultate or listen. We can listen to heart sounds, lung sounds, abdominal sounds. That tells us if our patient's GI system or gastrointestinal system is working. So these are all important things for us to learn, to auscultate the sounds by the body, made by the body, and what's normal and what's abnormal. But you'll get into that in your later courses. Other ways to examine the body is percussion. You may be thinking, percussion, is this a drum, right? Well, yes, in a sense, because some areas of the body are kind of like drums. They have that resonance sound, and that's normal for that particular area of the body. So when we percuss, we are tapping the body and we're looking for signs of abnormalities. We're looking to see, for example, is our lung resonant, which is normal, or is it hyper-resonant, which is an abnormal finding that you find in COPD patients, patients that have chronic obstructive pulmonary disease. So percussion is one of the methods that we use when we are clinically examining a patient. We also can use medical imaging. And so this is really amazing because it allows us to view inside the body without being invasive and putting the patient at any extreme risk. So radiology is a branch of medicine that is concerned with imaging. So again, imaging is non-invasive. We're not penetrating the skin or any body orifices. And we do have invasive imaging techniques that we can use. And so an ultrasound probe can be used inside of the body orifices. An example of this is a transvaginal ultrasound. So that is where a wand, an ultrasound wand, is placed into the vagina of the patient to examine their reproductive organs. So that's just an example of an invasive kind of procedure. Sometimes we have to perform an invasive procedure using a dye, a CT contrast that is injected into the patient's veins. So as the blood pumps, this dye will then circulate in all of the blood vessels, and this will allow the the image to be displayed so we can see the health of the patient, we can see the health of their blood vessels, and depending on why we're looking at a CT scan, the health of the organs. Now, here's an important nursing note. If your patient is having a CT scan with a dye or contrast, we always want to assess for allergies. Is the patient potentially allergic to shellfish or iodine? You're going to see this many times throughout your nursing career because if the patient is allergic to shellfish or iodine, we will have to notify the healthcare provider because they should not be receiving a dye or a CT contrast that has that kind of substance in it that the patient is allergic to. Again, shellfish and iodine. So let's talk about radiography. So this is a photograph and we're looking at the internal structures using x-rays. This is high energy radiation. And we know that x-rays, they are absorbed by dense tissues like bone. And so they will produce an image that is often lighter than in the soft tissues when you see this x-ray. So we use radiography in dentistry and when we're performing mammograms and also like if we're looking at fractures of a patient. If we think the patient has fallen, broken a bone, they will probably take them for an x-ray. So the disadvantages of radiography is that the images can overlap and we may not have a very clear picture. And too much exposure to radiation in this radiography is not good. Here's an important nursing note for radiography. If your patient is pregnant, they should not be receiving an x-ray. That's one of the questions that we ask before we take our patient in, right? We have to get this health history and physical information. Are you pregnant or possibly pregnant? Because if they are, we don't want to perform an x-ray on this patient. So here's a picture of an x-ray, and this is a sagittal view of the left side of the patient. So a lateral view, so a sagittal kind of cut, but a lateral view on the left side of the patient. And so we have the skull, we have the vertebrae, as well as looks like 7 cervical vertebrae, and just the tops of the patient's shoulders. But this is an example of an x-ray image. All right, let's talk about the CT scan. So that is computed tomography, also called the CT scan. So this is more sophisticated. It has low intensity x-rays and we get a slice of the body, okay? And there's less organ overlap and it's much sharper so we can see in more detail. And this is important for identifying tumors, aneurysms, and aneurysms are ballooning of the arteries, cerebral hemorrhages, so that's a bleeding in the brain, and kidney stones. So these are some of the reasons why a patient would have a CT scan performed. And here we have a transverse cut of the patient's head. It looks like, yes, I think the head or the spinal cord in this particular picture, okay? So yes, a radiological image of the head in this CT scan. So now we have MRIs. MRI stands for magnetic resonance imaging. Important term, you will see this throughout your nursing career. So better than CT scans for visualizing soft tissues. So this is important, for example, when we're looking at white matter and gray matter of the brain. And so this is a procedure where the patient is surrounded by a large electromagnet and the tissue responds to a magnetic field and radio waves. There's a computer there that analyzes the signal and then produces the image. So this is really a great opportunity for us to see what's going on with the patient's soft tissues. An important nursing consideration, if your patient has metal inside of their bodies, they are not eligible for an MRI because that metal will affect those magnetic waves, those electromagnetic waves. So if your patient has certain piercings that can be removed, that's great, remove those piercings, but the patient may have metal inside of their body. Maybe they have a metal plate, a steel plate, or some kind of hardware because of a hip replacement, knee replacement. That kind of patient is not really eligible for an MRI. The other thing that's important in nursing consideration for an MRI is your patient claustrophobic? Because the MRI takes, 60 minutes to 90 minutes, and they have to lie completely still while they go through this tunnel. And if your patient is claustrophobic, that may be a cause for concern. So you really want to make sure you assess your patient, let them know what to expect. You're going to provide them anticipatory guidance. If your patient may be a little anxious, sometimes patients may have to be slightly sedated, not put to sleep, but slightly sedated or given some medication to help ease their anxiety. And of course, this will have to be with a doctor's order. We never give medication without a doctor's order. The other thing that's important, I have seen in some NCLEX questions, if you have a patient that is deaf or hard of hearing, you want to let them know that there are going to be vibrations because the MRI machine does make some noise, and a patient that is of normal hearing will hear those noises. So, of course, you warn them about that. But if a patient is deaf or hard of hearing, they're going to feel the vibrations, and that might be scary to them. So you have to tell them ahead of time that there's going to be some vibrations as they will not be able to hear the sound. So here is another radiological image of the head. This is an MRI, magnetic resonance image. Okay, very clear, very sharp. We can see the brain. We can see the different parts of the brain. I can see the hemispheres of the brain as well as the cerebellum. We can see the major blood vessels. So really great picture. Okay, the next imaging we're going to talk about is a PET scan, positron emission tomography. So this is going to be an injection of a radioactively labeled glucose, and it highlights the most metabolically active areas of the body. And so if the patient gets a PET scan, it can be used to diagnose cancer. It can also be used to diagnose or look at the extent of damage in the heart tissue. And this is an example of nuclear medicine. And so when we deal with this, always think about what's my patient teaching? How can I keep the patient safe? And how do I keep myself safe? So for example, with x-rays, if you are going to be in the suite, the x-ray suite with the patient, they may be wearing a lead vest. You may be wearing a lead vest as well as a lead thyroid protector to protect you from that radiation. So you always want to think about what are my nursing considerations, my teachings for the patient, and how do I keep myself safe and keep my patient safe. Now here is what a PET scan will possibly look like, and different areas of different metabolic activity have different colorings, different colorations. All right, sonography. Okay, so this is another way to examine the body, right? And so we can see what's going on, the health of the patient, the health of the organs. And sonography, we use a handheld device against the skin. And we are looking at this, and this is nothing more than a high frequency ultrasound. And so this is really great because we don't have the harmful effects of x-rays, because there is a certain limitation to the amount of x-ray radiation that you want to expose your patients to. Now, the bad thing about sonography is the image is not as precise, okay? Now, an echocardiogram is an example of sonography. And so this is taken of a beating heart. So it's an echocardiogram, okay? All right, so here is what we think about when we think about these sonograms. We think usually of babies, right? Or really they're fetuses. Until they're born, they're actually fetuses if they're in the later stages. But here's a fetus at 32 weeks of gestation. And it's really great because you can see the eyes, the nose, the mouth, and it's really fantastic and phenomenal to be able to see these sonograms. Okay, let's jump into physiology. So when we think about physiology, again, we're going to look at some of the sub-disciplines of physiology. We're going to look at the characteristics that define an organism being alive. We're going to talk about homeostasis. Homeostasis is one of those million-dollar words that you will definitely need to know. And that's what we want for our patients, for them to have a state of homeostasis. And we're going to talk about how the body gets that homeostasis. And homeostasis means internal steady state. And the body maintains homeostasis by negative feedback and positive feedback. And we'll also look at maybe some variations inside of human physiology, because sometimes we know what's normal and what's expected, but sometimes patients, their physiology is a little bit different. And it could be based on their genetics. It also could be based on their ethnicity. So that's something important for the nurse to consider. So when we think about physiological sciences, remember the function or the job that these structures are performing, we think about neurophysiology, and that's physiology of the nervous system. Nervous system, I want you to think brain, spinal cord, and nerves. Pathophysiology, these are mechanisms of disease. Remember that pathogens are disease-causing organisms. So pathogens make us sick. They cause disease or illness in humans, right? Or in animals as well, right? Or other living creatures. Now, comparative physiology, we're looking at how different species have solved problems. So how have these different species maybe made some adaptations? Maybe they have evolved over the years based on specific issues. So examples of those that we may look at is water balance, respiration, and reproduction. And comparative physiology is really important because we do a lot of experiments on mice, on rats, on bunny rabbits, different animals. And so, unfortunately, we do have to test medications before we allow them to be tested in humans. So, when we think about comparative physiology, that's important as we develop new medications and even new procedures. Now, when we think about living, something that is alive, that's organized, okay, it's able to reproduce, it's able to expend energy. And when we think about something that is living, if they're exposed to disease, it can potentially cause death. Okay. Now, cells are the smallest unit of living things. And I think that's actually a test question too. So cells are the smallest functioning of a living organism. Okay. Now, when we think about living things, they have a metabolism. So they're taking in stimuli. There's chemical changes that are taking place. There's molecules that are being taken in. There's chemical changes that are being taking place. And there's a constant turnover of molecules in the body. We're taking things in, chemical reactions are taking place, and some molecules and items will be excreted from the body as well. So these are all life functions, okay? So when we think about living things, we also think about development. So they change in their form or their function over the lifetime. So think about a newborn versus a 90-year-old patient. So there's going to be a lot of change there. There's a transformation that takes place, okay, over the lifespan of the individual. Differentiation takes place, and this happens in cells and tissues. And these cells and tissues, they don't have a specialized function, but they will then change or transform into cells that are committed to a particular task. And also in living things, we have growth. It could be growth in size or growth in number of cells, for example. So these are all qualities of living things. When we think about living things, they also have excitability, meaning that they're able to sense stimuli and they're able to respond. And homeostasis takes place in living things, meaning the internal steady state. It doesn't matter that it's 25 degrees outside. My body, internal body temperature, wants to stay at 98.6. So if I don't dress appropriate for the weather, the body will try to get to homeostasis by a shivering mechanism. Shivering creates heat. Right, so that's just an example of how the body seeks to maintain homeostasis, that internal steady state. Okay, so examples again for homeostasis will be stable temperature, stable blood pressure, and even stable body weight. Another quality or characteristic of living things is the ability to reproduce. Reproduction is important because it allows the species itself to continue living on, and it allows that offspring to have their genetic code living on in their offspring. Okay, so offsprings are able to produce copies of themselves. Another quality of living things is evolution. So there's genetic change in the population over time, and it's seen in the population as a whole, not necessarily in individuals. There's something that we also see as we evolve are mutations. If you have followed the COVID-19 scenario, you know that there was big discussion when the COVID virus was actually mutating or changing, right? So not all mutations are bad, though. Some mutations can be beneficial to a species. So evolutionary medicine interprets disease in terms of biological history of a species, okay? So as we evolve, we change. Now, how does that affect the disease? So when we think a little bit more about homeostasis, that internal stability, that internal steady state, we're thinking of body temperature, blood pressure, body weight, electrolyte balance and pH balance, fluid balance. Those are all important things. When I think about fluid balance, I'm concerned about my patient being dehydrated, or I'm concerned about my patient that is retaining fluid. That could be your congestive heart failure patient that has swollen ankles. They have edematous or swelling of the ankles, okay? So if your patient is not able to maintain homeostatic control, that will in fact lead to their death, okay? If it's not able to be reestablished, it can cause illness, but ultimately it can cause death. Now, pathophysiology, this is a study of unstable conditions that result when homeostatic controls go awry. So homeostasis is very, very important. So let's talk about negative feedback and then positive feedback. So the most common mechanism that you will see is negative feedback. And so this negative feedback is a mechanism that helps us to maintain homeostasis, that internal steady state. So this is a change that's sensed by the body, and then it activates mechanisms that can reverse it. So it doesn't produce an absolute constancy. So it's constantly working and constantly being tweaked and fine-tuned and constantly looking at the variables or what's going on in the body. Okay. So the key for this is that this negative feedback mechanisms works to maintain normal levels. And those normal levels, for example, could be your blood pressure, your body temperature, your body weight, okay, the amount of fluids and electrolytes inside of the patient, right? So negative feedback is continually at work and it's constantly being tweaked. So here's an example for blood pressure regulation when we talk about this negative feedback that's working to maintain homeostasis. When we arise from bed, gravity pulls down away from the brain, blood pressure falls. Okay, baroreceptors near the heart sense this decreased blood pressure and send signals to the cardiac control center in the brain, which stimulates the heart to beat faster. This raises blood pressure and returns the body to homeostasis. So there's a lot of important things here to unpack. So this negative feedback is important because it helps the patient maintain a normal blood pressure, and the blood pressure normal range is 120/80. But what's important here for a nursing consideration is if you have a patient that struggles with blood pressure regulation and they may be on medication, one of the things we want to teach them is to arise from bed slowly. Do not just jump up and get out of bed, because that doesn't give their body a chance for that negative feedback mechanism to kick in. And so what it will look like, your patient that jumps out of bed, they become dizzy and then they fall down. Okay, so that's something that is very common, especially we see in our geriatric population. So a nursing consideration is to have the patient arise from a lying position, go to a sitting position, and let them dangle their feet. So during this time, that brain can stimulate the changes that needs to happen so the heart can beat faster and the blood pressure can be regulated. Okay, so that's a great example of negative feedback. So here's a great picture, and we see the patient that or the person rising from the bed, blood drains from their upper body, and then they have a homeostatic imbalance. Okay, so there's not homeostasis. So these receptors, baroreceptors above the heart, respond to the drop in blood pressure. So they signal the cardiac center that's located in the center of the brainstem, particularly the medulla oblongata. That's a portion of the brain we'll study. And then the heartbeat accelerates in response to the cardiac center. Now the blood pressure then will rise to a normal level and then homeostasis is restored. Now this is if all is well with this particular patient and they don't have any issues affecting their heart potentially or their brain or the communication between those organs, right? So this is the body kind of correcting for what the stimuli is being presented to it. All right, so when we think about the components of these feedback loops, we look at the receptor, and the receptor is the one that says, hey, there is a change in the body. So in our skin, we have temperature receptors. So when we go outside and it's 25 degrees, those receptors will say, hey, it is 25 degrees, it's cold outside. Those same temperature receptors, as well as pain receptors, will feel pain if you stick your hand into the oven, right? At a certain temperature, those pain receptors will kick in, right? But before those pain receptors, those heat receptors will say, hey, this is a hot kind of thing. We need to remove our hand. And if we don't remove our hand for whatever reason, maybe someone's holding your hand over this hot thing, then the pain receptors are going to kick in, okay? Now, those are the receptors. Again, they sense the changes, they sense the stimuli. Now, the integrating or controlling center, that's just the part of the body that processes the information and it makes the response decision. Like, okay, this is really hot, this is dangerous, I need to remove my hand. Okay, now in this example is talking about the cardiac control center of the brain that said to these to the brain, okay, now or the to the heart that okay, you have to increase your beating so we can restore normal blood pressure. Okay, now the effectors, they carry out the response, so they affect things, and so they help to restore the homeostasis, and the heart is an effector in the example that we used. Now, the response that's sensed by the receptor, that actually completes the feedback loop. Okay, now positive feedback. This is an example that we see, but not as frequently. But you still have to know the difference between positive and negative feedback and know under what kind of circumstance you would see each of them. So with positive feedback, we're still working to get to homeostasis, but this is a self-amplifying cycle where change in the body leads to a greater change in the same direction. So this is also sometimes a normal way of producing a rapid change. So you may be saying, okay, what's an example of positive feedback? So a really great example that you're probably going to see over and over, especially as you get into mother-baby kinds of classes, childbirth is an example of positive feedback. So the head of the fetus pushes against the woman's cervix, and that stimulates nerve endings, okay, besides other things, right? So it stimulates those nerve endings, and then those nerve endings stimulate the pituitary gland to secrete the hormone oxytocin, also maybe known by some of you as pitocin. And this stimulates the uterus to contract. Now, some of you maybe even have had children and you were given Pitocin or oxytocin to induce your labor. Absolutely, because the idea is this hormone will stimulate the uterus to contract, and that will actually hasten the delivery process. Now, with this positive feedback, these contractions push the fetus downward, and that even stimulates the cervix even more. And the cervix is the opening through which that fetus has to get through, and the magic number is 10, right? So that fetus has to get to 10 centimeters. So the woman's cervix has to be dilated so that head can go through, right? Go through that birth canal. Now, this positive feedback loop is repeated. Labor contractions are more and more intense until birth. Okay, so again, this is a positive feedback kind of loop, and it is a rapid change. Here is a great visual. Here we see the head of the fetus pushes against the cervix. Nerve impulses from the cervix are transmitted to the brain. The brain stimulates the pituitary gland to produce oxytocin, and the pituitary gland is the master gland, by the way. And oxytocin stimulates uterine contractions and pushes the fetus towards the cervix. Okay, so positive feedback. So a lot of times, positive feedback can be a harmful process. Okay, so another example of this is a very high fever. Fevers triggered by infection can be beneficial. Now, something to note is that is a normal response that your body has if there is an infection present, if there is a pathogen that is seeking to make us ill. The problem is if that fever gets too high, it can make the body too hot faster than the body can actually eliminate the heat, and it can actually become fatal. Now, before fatality, the patient may experience seizures. Okay, so that's why it's really concerning if someone has a very high fever. We're talking about 103, 104, 105. But the bottom line was 113, the patient can face death. So fevers should be taken very seriously. The patient should be monitored. We want to try to break the fever as well as replenish any fluids that they may have lost. Okay, so that's just another example of your positive feedback. All right, let's talk about physiological variation. So physiology is more variable than anatomy. So when we think about anatomy, most individuals have two eyes, one nose, two hands, two ears. Now, of course, there are exceptions to that, people that are born that are differently abled. Maybe someone was born with all of the extremities and parts that they're supposed to have, but there could have been an accident, something happened, and they have lost an extremity or an appendage or an organ. Now, physiological variation can change with the gender of the individual, the age, the weight, diet, physical activity, and environment. Okay, so when we look at our textbooks, most times values are given for healthy young adults. Just like earlier, I mentioned the value for blood pressure, 120 over 80. That is the standard. That is what we're aiming for, right? And I would expect a young, healthy adult to have a blood pressure of 120 over 80. So those are the values that we're given. Now, that doesn't mean that if I have someone that's 70 years old, that I shouldn't expect their blood pressure to be in that range as well. But if their blood pressure is not in that range, that may mean that they suffer from hypertension. So I have to take some further action. I have to notify the healthcare provider, right? So just remember, though, in textbooks, the values are based on healthy young adults. And so we have to look at that as we are examining our patients and keep that in mind. All right, so now let's jump into the human body plan. This is where we're getting into some real nitty-gritty stuff. And so when we talk about the levels of complexity, it can also be called the level of organization. We're going to talk about the anatomical position, anatomical planes of the body, anatomical regions, body cavities, as well as their linings, and the 11 organ systems. Okay, so what is an organism? An organism is a complete individual. Okay, that's you, that's me. An organ system is a group of organs that carry out a basic function. So the human body has 11 organ systems. So we have the circulatory system, respiratory system, digestive system. Those are just some examples of the organ systems. So here is the structural hierarchy of the human body. So let's start at the smallest part, right? We're going to go from least to greatest, from smallest to largest. We'll start with an atom, and then we have molecules, okay? And then we have macromolecules. Macromolecules combine to form organelles. Organelles combine to form cells. Now, these cells that are like-minded in their structure and function form tissues, and tissues then form organs. Organs work together for a similar function, and they form an organ system. These 11 organ systems then form the organism. This is something that you should be familiar with. This is something you're going to see again and again, and I can guarantee you this will be a test question. All right, so an organ, when we think about levels of organization, we're thinking about an organ is composed of two or more tissue types that work together to carry out a particular function or job. So an example of an organ could be the heart, the kidneys, the skin. By the way, the skin is the largest organ. It's the first line of defense against injury and infection. We think about muscles, we think about bones. Those are all examples of organs. Tissues are a similar group of cells that perform a specific function. And the body is composed of 4 different types of tissue. Later on, as we go talk about our histology, we'll look at those tissues under the microscope. But those 4 types of tissues are epithelial tissue, connective tissue, nervous tissue, and muscular tissues. Okay, those 4 types of tissues. Now, cells are the smallest units that can carry out the functions of life. And cells contain a nucleus, that's where the DNA, the genetic material, is stored, and also other organelles. In the next chapter, we're actually going to talk about the cell and the organelles. So these organelles, they are microscopic structure, and each of these organelles has a specific job, okay? Now, let's talk about the anatomical position. The anatomical position is important because this is important for us as healthcare professionals, so that we're all speaking and referring to the body from this anatomical position. So this is a frame of reference. So if you are familiar with mountain pose in yoga, it's very similar. If your patient is standing in the anatomical position, or you are standing in the anatomical position, you're standing upright, your feet are flat on the floor, toes are pointing forward, standing erect, your arms are extended, elbows locked at your sides, the palms facing forward, okay, towards the observer. And the head and eyes are looking straight ahead in the direction that the toes are pointed. This is known as the anatomical position. So this model that we have here in this graphic is standing in the anatomical position. Now you may also see some body planes. These are imaginary lines that we use to cut the body into these planes. So these are important to know. You probably will have some test questions on these as well, especially for your practicum. So let's talk about the 3 different planes. So the first plane I will discuss is the transverse plane. That divides the body into a top half and a bottom half. And top would be considered superior, and the bottom half would be considered inferior. Those are some terms that we're going to talk about towards the end of this presentation. These terms you definitely have to know. So that's the transverse plane. We have a sagittal plane, and this actually is a mid-sagittal plane. The sagittal plane divides the body into a left and right half. Mid-sagittal, meaning that the left half and the right half are equal, okay? That's like if I cut a cookie into, I put a line through a cookie and I say, okay, this part is for me, this part is for my daughter. If it's equal, right, the left and the right side will be equal. That would be a mid-sagittal cut. But if the one of the sides are a little smaller than the other, that's still considered a sagittal uh, cut or a sagittal plane, but it's not mid-sagittal because we don't have equal left or right parts, okay? The other plane that you see is the frontal plane. The frontal plane is dividing the body into a front and a back. Now, when we talk about anatomy and physiology, we don't use the words front and back. We'll say for the front is anterior. So for the back is posterior. So the frontal plane divides the body into an anterior, front, or posterior. Okay. So those are the three planes you will need to know. Again, the anatomical position and the body planes. Transverse plane, frontal plane, and sagittal plane. So these anatomical planes are based on slices. And so we will reveal internal anatomy. So will we actually section our patient? Will we actually cut our patients open? No. But if we're getting imaging done, we may have a sagittal view. We may have a sagittal section or a frontal section of the particular organs or structures that we're trying to see. Okay. So that's the importance of understanding these different planes. So sagittal, frontal, and transverse. Now, sagittal planes, again, they extend vertically, dividing the body into left and right portions. A median or mid-sagittal plane gives you equal left and right halves. Parasagittal plane, it's unequal left and right halves or portions. And that's like the cookie that my daughter cut for me, right? I got the smaller portion, of course. Okay, so here is a sagittal section. We are actually looking at the reproductive organs, and this is a female patient, I can tell, because I see the bladder, I see the uterus, and I see the fallopian tubes, as well as one of the ovaries here, as well as the colon, okay? So here is a sagittal section. Okay, now let's look at the coronal plane or frontal plane. This extends vertically perpendicular to the sagittal. It divides the body into anterior and posterior portions. So here is a frontal section, and we're actually viewing the anterior of this patient. And this really is to take a look at the lungs and the heart. And underneath the lungs and the heart, you see a muscular organ that is the diaphragm. Okay, so this is a frontal section, and we're looking at the anterior aspect. So transverse or horizontal plane, this is perpendicular to the body's long axis. It divides the body into superior and inferior. Remember, superior is upper and inferior is lower. So here is a transverse section that we actually saw something similar to this earlier when we were talking about our imaging. This is the brain. We see the cerebrum as well as the cerebellum, as well as the spinal cord, okay? Transverse section. Now let's look at major body regions. So the two major body regions are axial and appendicular. So the axial region includes everything but the limbs, because the limbs are going to be included in the appendicular portion. So when I think of appendicular skeleton, I'm thinking about the bones that make up the arms and the legs. Now, this axial region, this includes the head, the neck, and the trunk. Now, the trunk is divided into the thoracic region, that is the area above the diaphragm, which includes the lungs and the heart. And then the abdominal and pelvic regions are below the diaphragm. Okay, and we're going to look at some pictures in a little bit that's going to help you understand this. So when we're thinking about the abdomen is divided by imaginary lines that give it 4 sections, okay? So we have a left half and a right half, and we have an upper and we have a lower. when we are looking at the abdominal quadrants. So those two perpendicular lines intersect at the umbilicus or umbilicus, where the belly button is, right? That divides those quadrants. So we have the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. And those are the appropriate abbreviations that we use. What do you need to know about these? Well, you definitely need to know all of these quadrants, and you need to know the organs that are located inside of these quadrants. Because if your patient comes to you and says, oh, it hurts right here, and they're pointing to the right lower quadrant, you better be thinking appendicitis instead of gastric reflux. So it's important for you to know the organs and where they lie in these quadrants, okay? So here's a great picture when we talk about the quadrants, the upper quadrants and lower quadrants, the left quadrants and the right quadrants, okay? We have to know these quadrants and the organs that lie within. Now, these abdominal regions, now there are 9 regions of the abdomen divided by 4 intersecting lines. And again, these are all imaginary lines, okay? So we have vertical lines that are midclavicular lines. The upper horizontal lines are subcostal lines, and the lower horizontal lines are intertubular lines. Okay, and so these intertubular lines, they pass between the tubercles of the pelvis. Okay, now let's jump to the appendicular region. When we think of, because we were just talking about the axial region, now we're looking at appendicular. This is the upper and lower limbs, our arms and our legs. Okay, so for our upper legs, we're thinking arm, forearm, wrist, hand, and fingers. For lower limbs, we're thinking the thigh, the leg, the ankle, the foot, and the toes. So when we think about appendicular region, we also have to think about the segments of the limbs. And so this is regions between the joints. Okay, so an arm is a limb segment between the shoulder and the elbow joints. Okay. And this is useful as we're describing locations of bones and muscles. Okay, so here's external body regions, okay, external body regions. And this is an anterior view, also sometimes known as ventral view, but anterior we're used primarily. That is going to be the front, okay? Okay, so here are some external body regions. And then here's the posterior body regions, okay? So these regions are important to note, especially as you get deeper into your nursing, because when you are documenting and you're reading your doctor's notes, they may say the patient has a sacral ulcer. Well, I need to know where the sacral region is, because that tells me, okay, I need to look above the buttocks because that's the sacral area. I need to know where the lumbar area is in case the patient has a lumbar, pain or lumbar muscle tear or a lumbar wound or a lumbar incision. So it's really important for us to be familiar with these regions of the body, okay? All right, so body cavities is another thing that we need to know. And so these body cavities contain internal organs, which are also called viscera. And so these organs are lined by thin serous membranes that secrete a lubricating film. And this is important because that minimizes the friction so that these organs can work and function as they should. Now, body cavities that are open to the environment are lined by mucous membranes, okay? So serous membranes are in our internal organs, and mucous membranes are organs that are open to the environment. Now, I will tell you that the stomach does have a mucus lining because that thick mucus in the stomach actually prevents any tearing down of that stomach lining by the acid that lies within the stomach. But we'll talk about that more when we get to the digestive system. So let's talk about the different cranial cavities. And if you are a visual learner, make sure that you're looking at these pictures, these visual aids in your textbook. That's going to be extremely helpful. So you can be auditory, you can listen, and that helps you learn. If you're a visual learner, you might have to see pictures, or maybe you're a combination of both. Okay. Now, this cranial cavity, we're starting from head, working our way down, is enclosed by the skull. It contains the brain. The vertebral cavity is continuous with the cranial cavity, and it passes down the vertebral column, and the spinal cord is in there. Now, the meninges is 3 layers that actually protect and line both cavities of the cranial cavity and the vertebral cavity. And they protect the nervous tissue from hard bone. And you may have heard of meningitis before, right? That's actually, whenever you see itis, think inflammation. Meningitis is an infection or inflammation of the meninges. And that's a pretty serious conditioning, a life-threatening and usually highly contagious condition. Okay, so here's a great visual of the body cavities. Here we have a left lateral view, so we're looking at the left side of our patient. We see the cranial cavity, the vertebral cavity. We see the thoracic cavity. Underneath that is the diaphragm. And we have the abdominal cavity. That's where our stomach, our spleen, intestines are all within that cavity. The pelvic cavity contains our urinary bladder, some of our reproductive organs, and parts of the intestine. Now, you will see that there is an area between the two parts of the thoracic cavity that is called the mediastinum. The mediastinum contains the heart, the esophagus, as well as the trachea. So the mediastinum is a specialized cavity that contains the heart, the esophagus, and the trachea, as well as the thymus as well. And we'll talk about the thymus a little bit later. Okay, so here is a great visual of the major body cavities. You have to know these cavities, and you have to know the organs that lie within them. Okay, so the diaphragm is a muscle that separates the thoracic cavity from the abdominal pelvic cavity. Within the thoracic cavity, we have the mediastinum, the pericardium, and the pleura. The mediastinum contains esophagus, trachea, heart, major blood vessels, as well as the thymus. The pericardium is a 2-layered serous membrane that surrounds the heart. Pericardium is very important because it helps to reduce the friction of the heart when it's beating. Okay, and you don't want your heart to have a lot of friction when it's beating. Okay, you want your heart to be able to beat freely. Pleura are 2-layered serous membranes that are enclosing the lungs. Okay, that's important. So pericardium surrounds the heart, the pleura surrounds the lungs. Now, the abdominal pelvic cavity is subdivided into the abdominal cavity and the pelvic cavity. Okay, now the abdominal cavity contains most of your digestive organs, as we mentioned, your stomach, your small intestines, your liver, and such. Now, the pelvic cavity is the lowermost part of your intestine that's included, the bladder, the urethra, and your reproductive organs. So there is the peritoneum, and this is a serous membrane that lines the peritoneal cavity. We have the parietal peritoneum and the visceral peritoneum. So the parietal peritoneum is the outer layer that lines the abdominal wall. The visceral peritoneum has a mesentery and serosa. So have you ever heard of someone saying, oh, I had a visceral reaction, right? That means a gut reaction, right? So this is what we're thinking about. So the mesentery is very important because it actually suspends certain abdominal viscera from the body wall. And the serosa is the covering of these visceral surfaces. Now, if a patient has peritonitis, itis again is inflammation, just like we talked about meningitis. Peritonitis is an inflammation of the peritoneum. All right, so here is a great section. We can see this is a transverse section. We have an inferior portion and a superior portion. We have, in this picture, you can see posterior, that's going to be the back of the patient, and anterior is the front, okay? So in this section, we can see the kidneys, we can see some vertebrae, we can see some major blood vessels, the aorta, which is the largest artery, the inferior vena cava, which is the bottom part of the largest vein, the vena cava, the small intestine. We even see the liver, okay? So this is a great section, transverse section. Okay, here is a lateral view, a section that is the lateral view. This is a sagittal section where we can see the liver, we can see the stomach, the large intestine, small intestine. We can see the rectum, the bladder, and this is a male patient, so we also see the penis and the testicles. All right, so retroperitoneal organs. That's a word that's fancy. You're going to need to know that, okay? And so these are organs that lie against the posterior body wall, okay? So they're covered by peritoneum only on the side facing the cavity. So these are organs that are kind of suspended there. So kidneys, okay, the aorta, inferior vena cava, and the pancreas. So these are lying against the posterior body wall. Again, the kidneys, the aorta, and the inferior vena cava. That's the vena cava that's below the heart and the pancreas. Intraperitoneal organs, these are organs that are encircled by the peritoneum, suspended from posterior body wall by mesentery. So this has something, right? The mesentery is connecting it, okay? Now the small intestine has a mesentery, okay? But the kidneys, aorta, inferior vena cava, pancreas, they're not connected by mesenteries, okay? Now we're going to get into the last bits of this chapter. It's been a pretty extensive chapter, but great information, and all of it is important that you must be familiar with. Let's talk about the 11 body systems. We'll start with the integumentary system. The integumentary system is your first line of defense against injury and infection. It serves to protect you. It also serves to help water to be retained. It helps with thermoregulation, as it can help you cool down through evaporative cooling. It can also release heat as the blood vessels dilate. The integumentary system, particularly the skin, works with vitamin D synthesis as long as you're out in the sun. It also helps with cutaneous sensation. The skin is very sensitive. And also it helps with nonverbal communication. Okay, so think about the raising of the eyebrows, the furrowing of the eyebrows, facial expressions. That helps with nonverbal communication. The principal organs of integumentary system, I want you to think skin, hair, nails, and glands. Okay, so this is a great picture, great visual of the integumentary system. Our next system is the skeletal system. I want you to think of bones, cartilage, ligaments. Okay, bones, cartilage, and ligaments. Ligaments connect bones to bones. The function of the skeletal system is to support movement, provide structure, protect viscera. Blood formation takes place in the marrow of the bones. Also mineral storage in the forms of calcium and phosphorus. It also helps, the skeletal system helps with electrolyte and acid-base balance. Here's a great visual of the skeletal system. Now we're going a little rapidly through these systems, but as we continue through the chapters, we will focus in on each system one at a time. So muscular system, skeletal muscles are the principal organs. And I think of tendons because tendons connect muscles to bones. Now, the muscular system does work with the skeletal system to provide movement, stability, communication, control of body openings, and heat production. So here's a great picture, great visual of the muscular system. Something I didn't mention on the skeletal slide is that the human adult has 206 bones. Babies are born with about 300 bones, and humans have over 600 muscles. Okay, let's jump into lymphatic system. The organs that I think of: lymph nodes, lymphatic vessels, the thymus, the spleen, and the tonsils. So what's the function? What's the job of the lymphatic system? It does work hand in hand with the immune system. It also helps to recover excess tissue, fluid, to detect pathogens. It helps to produce immune cells, and it is a defense against disease. So if you've ever had a strep throat or swollen tonsils, and maybe you felt the side of your neck, or the doctor or nurse felt the side of your neck, and they said, ooh, your lymph nodes are swollen. The lymph nodes are important as they help to fight that infection. Okay, lymphatic system. So here we have a great visual with the lymph nodes, the lymphatic vessels, and the fluid that runs through them is called lymph. I like to think of the lymphatic system as the garbage collectors or the recyclers of the body. Jumping into the respiratory system, think of a molecule of air coming in through the nose and all the way to the lungs and back out again. So it has to hit the pharynx, the larynx, the trachea, the bronchi, which branches into bronchioles, and then it goes to your terminal bronchioles, your alveoli. Okay, so those are the principal organs. And what is the function of the respiratory system? To absorb oxygen, discharge carbon dioxide. The respiratory system also helps to maintain acid-base balance, and it also helps with speech. Okay, so here's a great visual of the respiratory system. Let's jump to the urinary system. Thinking urinary or renal system, think kidneys, ureters, urinary bladder, urethra. Kidneys, they are supposed to help with the filtration and elimination of waste in the body. The body excretes this waste through urine. So the kidneys make the urine, send it through the ureters to the urinary bladder, which is a muscular sac that holds the urine until it is ready to be expelled from the body. The urethra is the tube that takes that urine out of the body. Fun fact, females have a shorter urethra than males, and this puts us at greater risk for urinary tract infections. So the functions of the urinary system is to help eliminate waste, regulate blood volume and pressure. It helps to stimulate red blood cell formation with the secretion of the hormone erythropoietin. Okay, the kidney or urinary system functions also to help control fluid, electrolytes, and acid-base balance. And it also helps to detoxify our body fluids. Okay, so here's a great picture of the urinary system: kidneys, ureters, bladder, and urethra. All right, let's jump into the nervous system. When you think nervous system, think brain, spinal cords, nerves, your ganglia. So the nervous system is really important in rapid internal communication, coordination, motor control, and sensation. Here's a great picture of the nervous system. When you think nervous system, I want you to think brain, spinal cord, and nerves. That's going to be really important. Brain, spinal cord, and nerves. Okay. Endocrine system. So the principal organs are these glands, and these glands are secreting hormones. And these hormones help to maintain homeostasis, and it helps to maintain chemical communication and coordination. Now, these endocrine glands consist of pituitary gland, which is the master gland, pineal gland, thyroid gland, parathyroid glands, thymus, adrenal glands, pancreas, testes, and ovaries. Okay, that's your endocrine system. So this is a great visual, and it shows you from top to bottom pretty much. Also, it doesn't show you the pituitary gland, but that's in the brain. But it shows you the thyroid gland working on down in this patient. Okay. Circulatory system. Sometimes the circulatory system is grouped together with the cardiovascular system. So in this case, when we think circulatory system, we're thinking heart, blood vessels, as well as blood. Okay. So the principal function is to distribute oxygen, nutrients, and remove waste. Also to transport hormones, electrolytes, and heat. So another function of the circulatory system is to distribute immune cells, antibodies, and help with food electrolyte acid-base balance. Here is a great pictorial of the circulatory system. The red vessels represent arteries, which are going away from the heart with oxygen-rich blood and nutrient-filled blood to take to all the cells and tissues of the body. The blue vessels that you see are vessels that are actually oxygen poor and carrying waste materials back to the heart, so the heart can then pump it to the lungs so it can pick up oxygen. Okay, so red, oxygen rich, blue is going to be oxygen poor, and those are the vessels that we're talking about. All right, let's go to the digestive system. When we think about the digestive system, think of your teeth, your tongue, your salivary glands, your stomach, esophagus, your small intestine, large intestine. We think about the liver, the gallbladder, and the pancreas as accessory organs to digestive system. What is the function of the digestive system? Breaking down food into fuel the body can use. Okay, so we're absorbing those nutrients. We're also looking at the synthesis of plasma proteins, disposal of drugs, toxins, hormones, and cleansing of blood. Those are all jobs of the digestive system. So here's a great picture showing you the digestive system organs. And remember, the digestive system does have several accessory organs that help with digestion. All right, jumping to the reproductive system, let's look at the male first. Principal organs, the testes, epididymis, spermatic ducts, and penis, seminal vesicles, prostate gland, and bulbourethral glands. So what is the function of the male reproductive system? This system is responsible for the production and delivery of sperm, and it secretes the sex hormones for males, right? Which is your testosterone. So here's a visual of the male reproductive system. Okay, let's look at the female reproductive system. We're looking at ovaries, uterine tubes, the uterus, the vagina, mammary glands. Yes, the mammary glands are a part of the female reproductive system. So what are some of the functions, primary functions of the female reproductive system? Well, producing eggs. But this is where fertilization takes place, fetal development takes place, fetal nourishment, birth, lactation, secretion of sex hormones. So a lot's going on in the female reproductive system. So here's a great visual, and don't forget the mammary glands being a part of it. All right, so this was an important slide because it has a terminology that you must be familiar with. Ventral, which is also the same as pretty much as anterior, which is towards the ventral side or the front, and dorsal means towards the back, as does posterior. So ventral and anterior go together, dorsal and posterior go together. Superior means above, inferior is below. Okay, media or median is towards the mid-sagittal plane. Lateral is away from the mid-sagittal plane. Proximal is closer, or you think proximity, right? And so that is proximal is closer to the point of origin. Okay, And then distal is farther from the point of attachment or origin. So proximal to distal, close to far. Okay. Superficial, that means it's closer to the body surface, and deep is farther from the body surface. Okay. So the skin is superficial to the muscles, and the bones are deep to the muscles. At this time, this concludes our discussion of Chapter 1. Thank you for your attention, and remember to think like a nurse.